The first ever Asia-Pacific Cardio-Metabolic Summit was organized by CIMS and UBM Medica at Ramada Hotel, Powai on the 10th and 11th of October 2015. The summit intended to provide effective current prevention strategies, diagnosis and management of cardio-metabolic syndrome for daily practice.
Cardio-Metabolic Summit is a unique effort by UBM Medica to reach out to doctors across the western part of India. Our whole commitment is to give them the global news, the standard of care which is being applied across the globe, and to help them in evidence-based practice in diabetes as well as cardiology.
The first Asia Cardio-Metabolic Summit gives a huge opportunity for specialists, physicians, diabetologists, endocrinologists, practically every doctor who is treating diabetic patients to keep abreast with moving times, with newer technology, newer advances in the field of diabetes, and it gives them a complete picture into what is happening across the world, first-time data shown here, and it helps them become up-to-date with the changing scenario in medicine.
High blood pressure is a disease which more often than not we do not get to know unless and until we get the blood pressure checked. That's why we say the commonest cause of blood pressure is no cause, and the commonest symptom of blood pressure is no symptom, because we don't have any symptom and we don't have a cause, and unless you actually look for blood pressure by getting a routine check of the blood pressure, you may not even get to know of the blood pressure. And when you get the symptoms, that is a bit too late when your heart, lungs and other organs of the body get damaged.
This is the Asia Pacific Summit for diabetes and heart disease, and what is happening here is we are trying to develop guidelines for Indians because we have a theme. We want India to be the diabetes care capital of the world, and that is why the UDF with the UMP Medica has organized this Asia Pacific conclave where thought leaders in diabetes are discussing, deliberating and discussing all issues of treatments of diabetes, new, old, insulin, technology, so that we can make the lives of people with diabetes better. And if you need to prevent diabetes, my simple diabetes prevention mantra is eat less, eat on time, eat right, walk more, sleep on time, sleep well and smile.
The program featured many keynote speakers, state-of-art sessions, interactive discussions by national experts and a panel discussion.
I was able to speak to the audience and tell them about the efficacy, the safety, the usage in kidney disease, which is very important for diabetics, the safety of it in cardiovascular disease, and also to be able to say that it has a future in the use with combination with other drugs, which might make it one of the most robust molecules for the treatment of diabetes.
What I spoke about is what we known as the sulfonylureas. They are the older drugs in diabetes, which we have been using for the last 30 to 40 years. What I spoke about is the merits and demerits of this drug and where it stands a place, because we know they are one of the cheapest available drugs, and being in our country, they have a very, very important role in management of type 2 diabetes.
You can advertise only when you start your practice to tell the world that yes, Dr. Pingle has started his practice and he has a special skill in this branch. When you are going on leave, when you are shifting your practice, so these are the few exceptions where officially you are allowed. But otherwise, we are not supposed to advertise. If you are writing for lay press, any article, like there are some diabetologists, if they are writing an article about diabetes, please see to it that you don't print your photograph, you don't give your contact numbers.
Metabolic surgery produces remission not only for type 2 diabetes but other manifestations of metabolic syndrome such as hypertension and hyperlipidemia. Should it therefore also be considered as a useful adjunct or therapy for these diseases? Adding gastric bypass to lifestyle modification is associated with a greater chance of reducing surrogate endpoint for cardiovascular disease, HbA1c, low density lipoprotein, cholesterol levels, systolic blood pressure, all these things which were stressed upon in the previous talk. This is a slide which you would probably think that patient shouldn't come and ask you someday that doctor, if bariatric surgery is the most effective treatment for my diabetes, why didn't you ever mention it? Please keep your mind open to this particular surgical option or intervention. We may be able to help some of your patients.
After metformin, I still believe that anybody who talks of monotherapy has to play second fiddle to metformin. Because metformin is the soda of the diabetic cocktail. You can use anything, but after lifestyle alteration, you have to use metformin. So after metformin, if you have to look at combinations and newer medications, it's the focus on SGLT2 inhibitors. The ominous octet is decreased incretin effect, increased lipolysis, increased glucose reabsorption at the kidney, decreased glucose uptake, neurotransmitter dysfunction, increased hepatic glucose production, and increased glucagon secretion from the islet alpha cell with decreased insulin secretion. So this octet leads to hyperglycemia. And because of this, the diabetic is living on the edge. He gets trapped amongst one of these 8 mechanisms, usually more than 3.
Our approach is basically we either take the same limb or sometimes the opposite limb puncture. We get the diagnosis. As I said, this 50 cc contrast load, this is a 2-3-year-old slide. Come down to 25 cc contrast load for both limbs. So we can do an angio because one, the machines have become much better. The quality of contrast has improved in the last 2 or 3 years. And as I said, interventions are possible in the same sitting. So actually in 50 cc of contrast, I can do a diagnostic cum therapeutic intervention totally. And that is quite significant less dye which we are using as compared to what we used to do before.
The summit also witnessed the launch of the magazine Diabetes Today.
We just launched the first edition of Cardiometabolic Summit today. It was a very successful event. We had the best diabetologists as speakers for this event. We had delegates from all over the country attending the event. Since India being a large country, it is very difficult for everybody to reach one conference. So through the medium of this publication, we will reach our message to every diabetologist in the country.
All the keynote speakers and delegates were awarded mementos. Here's what the visitors who attended the event had to say.
These kind of sessions are very important because lots and lots of patients are having diabetes and they need to understand that diabetes or hyperglycemia is not the sole indicator for having a CVD event.
These kind of summits are definitely good for all doctors because you have everything on a single platform where we are looking at multiple specialists coming in and talking to you about different aspects of the disease and how important is cardiovascular disease and diabetes, since diabetes is affecting now 1 in every 4 individual in India. So definitely it is something which we have to pay attention to and see that it's been followed up on a regular basis. These summits are definitely useful.
It was a wonderful experience. Congratulations to UBM, UDF and Care TV for organizing such a wonderful program. We had a good meet regarding diabetes and cardiovascular outcomes, and plus a wonderful launch of our magazine Diabetes Today, which will provide us insights later on also regarding diabetes and various clinical trials that take place in this field.
It was an interesting experience listening to today's program. There were a lot of new insights about the recent advances in the management of diabetes and metabolic problems which occur, which we see on a regular basis. It helped us gain a better understanding of the recent events.
This event was a grand success with the aim of addressing the issue of diabetes and its relationship with cardiac problems, and the onset would surely bring about a change in the medical industry.